My name is Professor Michael Polkey. I'm delighted to introduce this short film about the sleep service at One Welbeck Lung Health. I'm a consultant here. I'm also a consultant in the NHS, and I hope you'll find the video helpful. Restless leg syndrome is a condition where the patient has fidgety legs, and you may have met these people socially, but these are people who can't sit still. So if they're sitting, as I am now, instead of sitting calmly, they might be sort of jiggling their feet a bit like this, and their symptoms are improved when they move about. So quite often such people will make an excuse to go to the loo or something so that they can get up and walk about and relieve the symptoms that are disturbing them. Now, there's a related condition that we call periodic limb movement disorder, where the patient's limbs move at night for reasons that are not totally clear, but the limb movement itself wakes the patient up and fragments the sleep architecture and can cause all the things that go with disrupted sleep architecture during the daytime, including daytime sleepiness. Now, people who have the leg movement at night don't always have the leg movement in the daytime, but they often do. And the condition is associated with low iron stores. So one of the things your doctor will do if he or she diagnoses the condition will be to measure your iron status and arrange iron replacement if necessary. But if iron stores are adequate, then there are some drug treatments that can be helpful in this condition. What are the common causes of sleep disturbance? Well, it is fair to say that very often sleep disturbance is, if you like, behavioural in nature, so insomnia, and sometimes that's appropriate. So we know that if we, for example, have lost a loved one, that we're maybe not going to sleep so well for several weeks or months. Sometimes it's just part of life. So if you live next door to noisy neighbours, or if you have small children, you're quite likely to be woken up at night. But there are also some specific sleep disorders. In adults, the two commonest sleep disorders are obstructive sleep apnea and also a condition called periodic limb movement disorder. And both of those we can identify and treat here at One Welbeck Lung Health.